Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News & World Report and are number 1 in New Jersey. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Mom with Moms podcast. It's been a minute since we've been here. Or I've been here at Bellworks in Homedale. We are in the thick of summer. I feel like we kind of just started summer because the weather has been like I mean, I'm sure that there's been a summer like this in my lifetime, but I don't recall one in quite a while. The weather's been very weird. So I'm like hanging on. I'm a summer person and like hanging on to summer and trying to enjoy all the stuff with your kids, but also like, you know, then having to entertain them and the complaints and the constant snacks.
Right.
But all that comes with it. So really enjoying this time and planning ahead for the fall. I can't believe this year is just like flying. I say that every time I probably get on this podcast, but the time just flies on by. So we are in July, at the end of July, and hoping to really enjoy all that's left of August before back to school, right? So today we are continuing our family healthcare series with Hackensack Meridian Children's Health. Our guests today are Dr. Nicole Marcantuono. She's the Chief of Pediatric Physiatry at Jersey Shore Medical. Mm-hmm. Thank you for joining us. Mm-hmm. And we also have Dr. Felicia Gliksman. She is a pediatric neurologist and also the director of the Concussion Center at Hackensack Meridian Health. So thank you so much for joining.
Thanks for having us.
Thank you.
We are discussing all things concussions today, which is kind of specific, but your world that you live in every single day and super important topic. We were just chatting a little bit before we hit the record button now. And I have which I guess is a good thing, virtually no experience with concussions. I've not had one. My kids have to date, knock on wood. Sorry, Connor. Knock on wood, have not been concussed. My husband, on the other hand, has had several concussions, but before I met him, because he played professional baseball and was just a rambunctious child from what I hear. So he is, I say to him all the time, you've been hit in the head a lot. So I'm excited to explore or interested to explore all things concussion today and really get some valuable information out there to moms who are, maybe had experience with it or, wouldn't know what to do when they are faced with their child being, having a head injury, right? Mm-hmm. So with that said, what are some of the symptoms that you will find, and are the symptoms different in different age groups when you are when you think that your child has suffered a concussion?
Yeah, so even before we, I think, break it down into different age groups, it's important to understand that every individual and every time they have a concussion, the symptoms can actually look a lot different. So the symptoms are not always the same.
Okay.
I would say the most common symptom and the one that people tend to know about the most is headaches. That's the most common thing we see, sometimes exactly at the time you get hit in the head and sometimes slightly delayed after that. Some of the other symptoms that we see that are common: dizziness, nausea, feeling confused, being off balance. Some of the initial symptoms can sometimes include, I should say, loss of consciousness, whether it's briefly or for several minutes on the field. But I think a big thing that's important to note that 20, 30 years ago, we didn't always pay attention to is that loss of consciousness or passing out is not a necessary thing that needs to happen in order to have a concussion.
Okay.
I actually get that a lot when I see patients as well. I didn't have a concussion. I didn't pass out.
Oh, and so okay. I wouldn't even know to say that.
Yeah.
Okay.
And so exactly, to drive the point home is that you don't have to have
Right.
that loss of consciousness
Okay.
there. But you may be feeling foggy or have a change in ability to pay attention or lack of concentration, and sometimes even memory issues that could also happen with a concussion.
Interesting. So what exactly happens to your head when you suffer a concussion
So
or your brain?
yeah. So basically, a concussion is the symptoms that result after your brain gets jarred within your skull.
Okay.
So whether it be an actual direct hit to the head, or it could also be a transmitted force from elsewhere on your body that can cause your head to your brain to be jarred within your skull.
Like in a car accident or something?
In a car accident, or if you fall down and you land on your bottom, that force can transmit upwards as well. And so those are, some other examples that can happen.
Are there different types of concussions or just different levels of severity?
Very good question.
Yeah. So sort of the important thing to note here is that a concussion is a brain injury. We used to say, oh, I just got my bell rung. But the important thing is it's not a transient event that happens. It is a real injury to the brain. So that's why we take it so seriously at this point in time. So anything can kind of happen to cause that concussion, as Dr. Gliksman alluded to.
Right.
And everyone will kind of look different. So going back actually to one of your earlier questions about do the different age groups look different? Certainly when children are verbal, and especially the later school-aged kids, they can tell us exactly what they're feeling and what's going on. But even a baby can have a concussion. A toddler can have a concussion, and they don't have the words to explain to us what's going on or how they're feeling. So some things that you may not see in older children and adults, but see in the younger ones is loss of appetite, being extra clingy or irritable, their sleep patterns changing. So it's important to pay attention to those things.
What are some ways that babies, I'd assume the car accident has come up a couple times, but what are some other ways that babies will get a concussion? Just like whacking their head on something or?
Oftentimes falling.
Okay.
So sometimes falling off of things, falling off the changing table or being placed on a bed or a couch.
Right.
And an adult walks away briefly or turns around quickly to get a wipe or a diaper. Unfortunately, we've seen parents or other caregivers fall while holding a child, falling downstairs. So those are the ways that we tend to see.
That makes sense. Okay.
And also, as we were talking about a little earlier too, is that rambunctious toddler who likes to jump off of the couch or make believe they're Superman.
Yeah.
Definitely those instances can, cause things too.
Okay. So while we're on that topic, you have my son was very much that, that toddler, and he was, always jumping, and, you have a kid who jumps off the couch, right, and gets a big welt on their head. I know when the schools call, right, like most schools, it's like once a week with my daughter. Grace is fine. She hit her head, and we put some ice on it. I don't see any swelling or whatever. Okay, good. So I think the schools have to call, right, if it's like above the neck. Right. But like, as a parent, you kind of have that sometimes that like that. That within you that whether or not it's like serious, but do you like if you see like a little swelling or like a bump on the kid's head, are you always supposed to like get them checked out, and kind of what's the guideline there in terms of like getting them checked out to make sure it's not a concussion?
Well, first of all, no one's going to fault any parent from scooping their kid up and bringing them to somewhere to be seen, whether it be to the pediatrician, urgent care, ER. No one's going to fault you for doing that.
Right.
If, like you're saying, should I do it? Should I not? Always pick up the phone. You can always call your pediatrician. They'll talk you through what's going on. How does baby look? How did it happen? And what to look out for in the next few minutes, in the next few hours, and can help kind of guide in terms of if the baby or your child should be evaluated.
Okay.
Yeah. I think one of the big things to look out for is any changes in your child after they bump their head. So all of a sudden they're more sleepy than you expect them to be. They're irritable. They're clingy. They don't want to eat, they're nauseous. Of course, if they're vomiting or complaining of a bad headache, but they're complaining of blurry vision, those would all be signs that you have a concussion on your hands.
So they are have some of those symptoms, and they do go get checked out. What can a parent expect if they do in fact have a concussion? What does the treatment look like? Is there a treatment? I have no idea.
It's a good question as well. All great questions today. Really, everybody's very individualized. I tell my patients that it's an art and not, the next patient who's waiting outside with a concussion may have different symptoms as well as a different time length of symptoms and then different treatment. But typically, it's based on the symptoms that you're having. I also have to take into consideration the time of year. So if they're in school, how is school going to be affected? Do they need special accommodations? No homework or no testing for a few days, as opposed to the summer, they don't have to really worry about that. And then, maybe, taking into consideration, they go to camp. Well, what kind of camp? It's a horseback riding camp versus just the rec camp. So all those things have to be taken into consideration when you make this treatment plan.
Okay.
So if someone does have headaches, we may recommend some, brief course of like over-the-counter Tylenol or Advil at some point, or if they are nauseous and they can't eat, maybe some anti-nausea medicine. But also, they may have neck pain, they may have some other balance issues. So then we may recommend physical therapy or something that we call vestibular therapy, which could help with balance. So everybody's an art.
Okay.
I would say, I think a way that I explain it to parents when they're bringing their children into clinic, which I think makes sense for most people, is though a concussion is a brain injury, there is no associated, bleeding or swelling that's going on there. It's more of a functional injury. So it's almost as if the wires of your brain computer short circuit. So there's difficulty sending those electrical signals back and forth, and that's what leads to those symptoms of concussion. And then the brain also temporarily loses some of that energy that it has, and it can't remake it. So the first 24 hours, maybe 48 hours, we're saying, let's let the brain rest. Let's cut back on screens and electronics. Let's stay out of school if you're still having those symptoms. And then we want to gradually reintroduce those activities, as Dr. Gliksman was saying. What types of things or accommodations do we need to put forth in school so that the child can continue to be successful in their learning while still maximizing their recovery from that concussion injury as well?
So when they are first concussed, I don't know why I thought this is like a misconception or some type of myth, but you are not supposed to stay awake, right? Don't let them go to sleep. That's like what I remember being told when I was little. Like, if they're a concussion, you're not supposed to sleep. And I remember being so nervous to ever get a concussion because I'm like, what if I accidentally fall asleep? So that's not true.
Right. So I also take into consideration, again, it's that art of what time did this occur? If the family is bringing this child into the ER at 10 o'clock at night, it's bedtime, right? And so as opposed to earlier in the day, and again, asking about the symptoms, like are they overly drowsy? Is that for us a red flag that something else is going on?
Okay. Most
of the time and most of the instances is that, as Dr. Marcantuono was referring to, is that it's a brain reboot mode. And so you're going to have to rest. There's an energy supply that is required, and all these electrolytes and everything decrease, and so we have to reboot everything. So sleep is okay. If you feel the need to go in and check on your child, I usually recommend not completely waking them up and asking them, what day is it? What's your name? Just rouse them a little bit, and if they react, okay, then you can go back to sleep, and everybody else can go back to sleep. You don't need to be awake and staring over your child.
Okay.
Again, if there's any questions, you could always ask your pediatrician for advice of what to do, if you don't know what to do.
Got it.
Yeah, I would say there are certain things that we watch out for. So certain times that you would not want your child to just go right to sleep, but you would want them to get checked out very quickly would be, their headache is getting progressively worse, and along with it, they're getting progressively more confused, disoriented. If they're continuing to vomit multiple times, more than 2-3 times, and that's persisting. Certainly if their speech is slurred, they're not walking, they're not moving one part of their body as well. Those would be reasons that you definitely would want to bring them in to get evaluated instead of letting them go right to sleep, even if it is 10 p.m. at night.
So let's backtrack a little bit. We don't obviously want to scare anyone, but also, we wanted to make sure that moms are aware that, the kids' head injuries can be, detrimental to their health. And I always like to know, what is the worst possible outcome? And I know you mentioned that it's kind of different for every person, but also what are extreme cases, and what can concussions do for in a short term for your child, and also and adults too, and long term as well. What are the symptoms? What can it do? Why is there a concussion center? And what are the things that you treat your patients for after being concussed?
So what I do tell my families is that, I also don't have a magic ball and everyone's going to feel better. But what we do know is most people feel better in a day or two.
Okay.
Another subset, most people then afterwards feel better, within 7 to 10 days.
Mm-hmm.
What we do know in pediatrics and in the adolescent population is sometimes they do tend to take longer, about 4 weeks or so. They can.
Okay.
Personally and anecdotally, I find that those are more of my students during the school year who have a lot of schoolwork. So they don't have that time and that luxury to sit home and get better, right? Mm-hmm. But most of the time within a month, most people feel better. It's those that subset, that small amount of patients who have persistent symptoms, whether it be most of the time headache, maybe dizziness, balance problems, reading exacerbating all of these, which again goes back to school and having to do the schoolwork.
Interesting.
So at that point, I would say that's most of the time where they show up in my clinic, where there are persistent issues going on, and the pediatrician, really is maybe it's time to now see a specialist for it, is then doing a fuller examination and seeing if there's an issue with the balance center of the brain or with eye movements, and then sending them for the specialized therapy. Okay. Or with memory and concentration also, then there's therapy for that as well.
Interesting.
Yeah, so I tend to see patients from the day after their injury all the way up to being referred at a month out after they've sort of failed treatment with their pediatrician or primary care provider. So, like Dr. Gliksman said, most patients are getting better relatively quickly. Probably about 15% of people with concussion will still be recovering at that 4-week mark. Mm-hmm. The reason to be seen and to take concussion seriously, not only that it is a brain injury, but also while that brain is healing, it's more susceptible to another injury, and not just a concussion, but a more significant traumatic brain injury as well. So that's the reason that over the past couple decades, we've been taking concussions more seriously.
Okay.
Though we expect full recovery to take place each time you have a concussion, we know that the risk or how easy it is to get another concussion slowly starts increasing.
Interesting.
And then at some point in time, and we don't know exactly how many concussions it will take, there are probably many individual and family risk factors, but at some point, that's when we worry that the brain's not going to be able to heal itself completely.
Okay. So, go ahead, sorry.
I actually use an analogy that I feel more people are able to understand, is that a concussion is an invisible injury, right? And so the teachers don't get it, my friends don't get it. And I say, well, unfortunately, it's an invisible injury. It's not like you twisted your ankle playing soccer and you limped off the field and your trainer taped it up and put an ace bandage up and said, you're going to go sit down and ice it and elevate it, and maybe tomorrow we'll see how you're feeling, right? So then the next day you wake up and you try to walk on it and it still hurts. What are you going to do? You're going to stay off of it again.
Yeah.
And so that's how we're testing out the brain from that standpoint.
Mm-hmm.
But sometimes if you have that persistent player who's going to keep going or even like a gymnast, right, going out and playing on it, eventually it's going to be repeated injury on top of an unhealed injury.
Oh,
and at some point, you're going to have to stop doing what you're doing because you have so many injuries at the one spot that it's not healing properly anymore.
Got it. Okay. So let's talk about sports a little bit because I know we talked about the younger kids and how they're getting injured.
Mm-hmm.
Do you see many patients from sports injuries, or is it kind of like all over the map in terms of how they're getting injured?
Majority for me is sports.
Yeah, I would say definitely a lot of sports injuries, but very mixed overall. And we have to sometimes in the sports injury bubble, we also kind of include recess injuries, gym class injuries.
Is that where you're seeing multiple injuries though from sports, or does it really just depend on the patient?
I would say it depends on the individual.
Okay, that's interesting.
Yeah, certainly there are some that have, repeated injuries playing football or hockey, soccer, but there are others that are athletes that experience a concussion because their brother hit them in the head with a thrown ball or other reasons as well.
So are the patients that have suffered multiple concussions, what type of symptoms will they have like long term if they're like not healing, right? If they're not taking the time to heal themselves?
Well, one of the things to kind of go back to what you were saying earlier is that we have to prevent further injury when you're not fully recovered. And what we do know is that with repeated injury, you may have longer period of time with symptoms and or more symptoms. And so with repeated, all those things can accumulate. It may be a difference if you had a first head injury when you were 2 because you were jumping off the couch, and then your next one is 11 because you were playing soccer, and then another one when you were 18 playing football. Or it may be even worse because you had 3 injuries within a year because you were playing football. And so again, taking all that into consideration, what we would see more often, I would say, with our chronic patients, headache, concentration issues, memory issues, sometimes balance issues. But I would say the memory and the cognitive part is probably the one that plays the biggest role.
Oh, that's interesting.
Yeah, I would agree. And then the only other thing next would be those headaches.
Okay. Is it like a migraine type of headache or? Okay.
A lot of times.
Are people
not always.
who've had concussions more susceptible to having migraines in life? Is that
So typically, one of the things that we do ask is if they have a history of headaches before their concussions. And we could see that the people who do have a history of migraines or more frequent headaches prior, they tend to have like a worsening or exacerbation of that.
Oh, that's so interesting. Yeah. So let's talk about preventative. When you talk to, these adolescent kids and they're, they just want to play their sports and they just want to get back on the team. What are some things that like you're telling your patients that they can do to make sure that that doesn't happen again?
So it does actually start with the coaches.
Okay.
And, they're all required with having proper concussion training, as well as, and that's just preventative play. And so when they are in practice, learning the right way to play to prevent concussion, but also what signs to look out for above that. Then it's also educating the parents. So some teams will have like parent sessions on concussions because who's watching the games and looking everywhere. It's those parents. So what signs to look out for? If someone falls to the ground and they get up quickly and they shake their head or they're holding their head or they're stumbling, they need to speak out as well. Okay. And then educating the team and the teammates of these are the signs as well. It's not cool to play with an injury. That's not the saying anymore.
You don't need to man up, right?
Exactly. Right. And it's okay to miss one game than a whole season. So just step out, get checked. If you're okay, good. They'll send you back in. If not, they'll have you sit on the bench and cheer your team on and see how you're feeling the next day.
Okay.
Yeah. The only other thing to add to that is, especially with sports, but also including cycling, riding your bike, to make sure that you're using the proper protective equipment. That's certainly going to decrease your risk of all types of injuries.
Wear your helmet.
Yes.
Wear your helmets. Yeah. Is that a law? Is that a state law? We talked about this on another podcast and I never looked into it.
When I was in med school in Florida, it was. And they used to, like at the beginning, they would bring the kids home in the police car.
They would.
And then give the parents a ticket.
Yeah.
I don't know if it's...
I have to look into it because my mom was dying the last time this got brought up. I think it was with Dr. Moses, actually. We were talking about summer safety. And I was saying how I think my parents told us that it was against the law. So we would wear our helmets to like scare us or whatever. But I was like, I wonder if it was actually a law. And she's like cracking up. She's like, I don't even know if it is, but that is what we were doing. So whatever it takes, right? Just to make sure that the kids are doing what they're supposed to.
But also going along with what the parents are saying, but I always turn to my patients as well, and the teens especially, that they're rolling their eyes. It's about prevention. So besides the helmets on anything with wheels, besides a car, you're wearing your seatbelt, but cleaning up your room and making sure you don't have any tripping hazards, and just being smart. And, a lot about pediatrics is anticipatory guidance and prevention, and what can we do to help prevent. And it's really teaching the kids smart ways to play and the right ways to play and the right ways of practice. And that's been a big change, especially with the NFL going all the way down into the, the little peewee leagues of the proper way to have them practice, yet learn the right moves as they go up in different leagues.
Interesting. It can be a very scary experience, I'm sure, as a parent. They're treated and diagnosed with a concussion. They're coming home, no matter what the age of their child. What is like a general treatment plan to like stick to, and also to, not to worry so much? You said that, most people are okay within a few days, if not within the week. But I know myself, I would be like all night long, like, oh my gosh, is she okay? You mentioned possibly Tylenol or Advil, rest, no screens. That would be an issue in my house.
It's an issue in every house.
And anything else to send out there to moms that...
So I think the important thing is, as your child is feeling better, especially when they've been kind of laying around the house, not doing anything for a day or two, it doesn't mean you want to send them full blast right back to a full day of school, full screen time, doing everything, doing gym class and sports. You want to kind of gradually ease back into things, just as if, your child broke their leg and they were in a cast all summer and football season is starting up. You're not going to have them go from the day they get the cast off to immediately going and tackling everybody on the field. You're going to gradually work your way up. And sometimes with physical therapy and occupational therapy, and sometimes we won't need that. So that gradual reintroduction, and then just rehabilitating, getting back up to where they were before the injury happened.
Okay.
And one of the things we haven't mentioned is, that return to sports, but one of the mottos is return to learn before return to play. So if your kid is not tolerating going back to school yet, it's not time to go and jump back into football practice.
Okay.
So again, that's one of the other things that help us monitor recovery as well.
Okay.
So we would say absolutely no contact activities, and in a lot of places that includes gym class until that full recovery has taken place.
Okay. You mentioned a depletion of electrolytes. Do you also recommend hydration too?
Hydration is always going to be important, for sure. And also, if someone's having a persistent headache, we always talk about proper nutrition. Also, are you eating breakfast, lunch, and dinner? A lot of teens do not eat their breakfast. No. And I say your brain needs your fuel in order to get you through the school day as well. So I use that as a little incentive. Like, I know you want to get back to sports.
Is it true that like some headaches are, depending on where it is, it depends on, like, it can be indicative of like being dehydrated or like a real problem? Is that like, they're true? I don't know. I read that somewhere.
No, I mean, there's different types of headaches, right? You have what everyone talks about, your like migraine type headaches, but a tension headache, that can occur anywhere. If you just think of yourself, you have some muscle tightness up in your neck and shoulder area, you can get a headache in the back of your head. It can come around to the front. It can wrap the whole way around. So the location of headaches doesn't necessarily give us a ton of information. The treatment is going to be starting with hydration. Right. Certainly over-the-counter medications like Motrin or Tylenol when you need it, but you also want to be careful about giving it to your child 3 times a day for 2-3 weeks, because that can cause rebound headaches to occur. So it's always important to just be under the guidance of a physician or other healthcare provider who can help you figure out how to best treat
right.
those symptoms.
Okay. So we talked a little bit about where to go. Obviously contact your physician initially to, find out if you need to take the next steps to go to the ER or, to be seen in the office. If there are parents out there right now that are struggling with, maybe a treatment plan and or just, persistent symptoms, what resources are available to them through Hackensack that they can look into to hopefully help them out a bit more?
So I can speak up at Hackensack. Again, depending on what persistent issues may be, we may have to treat the chronic headache component to get over that. In terms of if there's persistent cognitive issues like difficulty memory or difficulty with concentration, reading, we may send you to a physical therapist or a cognitive therapist to help with those issues there. Some of my older patients, we may actually have to send to a headache specialist,
okay.
For some other outside of the box recommendations. Sometimes when you can't play and you can't go to school and you can't do what you love to do, it can affect you mentally. And so you can have some depression or anxiety because I don't want to go back and get hurt again. So we do have cognitive behavior therapists and counseling psychologists that we could refer to as well to help kind of get over that.
Okay.
And then the other resources to talk about we mentioned how concussions affect your thinking, right? Your ability to concentrate, remember things, function well in school. So we utilize some computerized neurocognitive testing or just testing of thinking on a more objective test, kind of like a standardized test that we use for children who are 12 and over. For children who have some underlying learning difficulties, attention issues, sometimes that's not the best test, or if they're younger than 12, we also have a neuropsychology as a resource. So that's a specialist in our memory and our thinking who can help us kind of dive deeper into that memory and figure out what we can do to help them be more successful in school and help us determine when that thinking part is fully recovered.
And one thing also that, knowing who our audience is here today is every school district is different. And we can make all the recommendations in the world, but sometimes the school districts, and even if they're in a private versus public school setting, there's different laws and requirements that they have to but they don't have. Either they have to or they don't have to listen to our accommodation recommendations.
Got it.
And so sometimes we have to reach out to our school advocates to try to help those parents as well. So if anyone's really having a hard time with the school, not getting the accommodations in order to help their child best succeed, then again, they should definitely reach out for some guidance.
Oh, that's very helpful. I love that. Well, thank you so much. Today we broke down all kinds of information about concussions. I learned a ton, and I'm sure lots of moms listening will too. I'm sure it's a very scary experience, and no one wants to go through that. But knowing what to do, I think, is really, really integral into having the best outcome for your child and even for yourself, right? Like I said, I smashed my head on the cabinet the other day, and now I know what to do. But thank you again. I will link the website for Hackensack, the Concussion Center. So if anyone needs more information, it'll be linked here under the podcast. And hopefully they can get the treatment that they need. So thanks again.
Thanks for having us.
Thank you so much.
Right now, we are still in the thick of the summer, so make sure to check out the Monmouth Moms Outdoor Dining Guide. We've listed and updated all of the hottest spots to go dine with and without the kids this summer.
That was going to be my question.
Yeah. So there's date night spots if you want to hang out with your girlfriends or bring the kids. We have a whole updated list on there. And then we also have our guide to beaches and pools, which is a cool one. We do that every year, and it's updated with all of the seasonal passes and daily passes. So if you wanted to do, like, we always do a bucket list every summer, and we get to like half of it. But new beaches that you want to check out, or splash pads. We have all the beach clubs on there. Most of them are waitlisted, but they're on there. And you can also check out and all the pool clubs, right, that you want to join. So check that out for sure. We have our summer fun guide right now. Eastmont Orchards, you can go peach picking, which a lot of people don't know, in the summer. So that this is actually the season for it right now. And there's a lot of cool stuff in there, indoor and outdoor, because the summer's been so crazy. So we have some rainy day activities in there as well. So check all of that out. And we also have free and fun activities too. So as everything is getting so pricey and you just don't want to spend $400 going to the water park every other day, you can also check out that guide, and we have all kinds of park programs in there through the Monmouth County Park System, and free activities to do with your kids that won't break the bank. So with that, enjoy your summer, and we'll see you guys soon.
Thank you.